So in previous class, we discussed about vitamin D and vitamin E. Okay. Today we will discuss two important one fat soluble and another one is water soluble. So first we will discuss vitamin K and vitamin C. So basically, vitamin K. Vitamin K was discovered in 1934. Okay. Okay. Who discovered? Danish. Okay, Danish Dam. He found that bleeding in chickens can be prevented by giving lucerne and decayed fish meal. The active principles in these materials could be extracted with the either, and thus a new fat soluble vitamin was discovered. Okay, and also known as coagulation vitamin. It will call K. From the K, you are called coagulation. Okay, so we have vitamin K1, K2, and K3. Different structures are available. K1, K2, and K3. Okay, same function but structural difference is there. So now, what is the function of vitamin K? The main function of vitamin K, it is in blood clotting. So in the body, it is in non-active form. Whenever bleeding occurs, it activates and here it will do the coagulation. Okay, so it is mostly used in the liver because liver synthesis various types of blood clotting factors. Like we have prothrombin factor 2, proconvertin factor 3, plasma thromboplastin, component factor 9, factor 10. Okay, so it will necessary to produce those factors. Means whenever bleeding happens, so those factors will go there and try to bind the area, surface area, coagulation. Coagulation will happen. Okay. So what it will do, it will convert. So vitamin in the presence of vitamin K, it will convert. Okay, convert into factors, whatever factors we need for clot. Okay, so this is the main function of vitamin K. So important role or preventing calcification of erythematous plaques also in the body. Okay, and so this is very important. So it is deficient is very rare because it is fat absorbable. So if you take and you will take in the body, it will stored in the fat. Okay, so deficiency is real. If what happened, deficiency will happen. So what will hemorrhagic diseases will happen? Hemorrhage will happen. Bleeding will happen. Okay, hemorrhages will happen. So we have to mostly what will happen? Mostly nowadays we have clots in the brain, okay, in the heart. Sometimes it is not. It is due to the deficiency of coagulation factors. So what happen if early coagulation happens? If early ischemic diseases happens, if early brain stroke or heart stroke happens, so doctor will do the test of this coagulation uh, coagulation profile. So in that they will see all the coagulation factors. So whether any coagulation factors is increases due to the immune system or due to the hereditary issues or any reason. So nowadays, early stage strokes are common in the adult, young, even in children's. Okay, so it is our duty to take the proper amount of vitamin K from the diet. Okay, how much amount of vitamin K is needed? WHO recommended for vitamin K is 55 microgram for adults. Okay, and ICMR also it accepted. Okay, so what happened in the uh, so basically in the India, mostly newborn premature baby seen deficiency of vitamin K. Okay, other than that, adults, childrens, and other old age vitamin K deficiency is rare. What happen if the vitamin K deficiency happens? So what happened? Bleeding will happen. So in the hemorrhagic conditions, doctor will advise vitamin K injections also. Injections IM they will advise. Okay, according to the condition. So what are the sources? So we know that the sources are leafy vegetables. Leafy vegetables are the main source and also found in fruits, okay, tubers, okay, seeds, dairy and meat products. Okay, vitamin K usually occurs in association with chlorophyll in the chloroplast of plants. Okay, alpha is a special rich source. The average diet provides enough vitamin K, hence there is no need for a supplement. So vitamin K is very found in every food, mostly in the leafy vegetables. Vitamin K produced by clonic bacteria does not fully meet the need of the human body. But in our body also, our good bacteria is there, which will give not sufficient amount, less amount of vitamin K. Okay, but it is not uh, required amount. We have rich source of vitamin K is alpha. It is a herb that grows throughout the world. Okay, so it having vitamin K. And other than that, we have Amarnath leaves, very having rich content of vitamin K. Betel leaves, drumstick leaves, fenugreek leaves, gogu leaves, okay, spinach, drumstick, coriander leaves, tamarind leaves, curry leaves. Having very large amount of vitamin K, all the leaves. So because of chlorophyll, carotene, all present, so you will get the vitamin K. Okay. So this is all about vitamin K. So this is the fat soluble vitamins. They are all about. So we are studying fat soluble vitamins A, D, E, and K. So now we'll discuss water soluble vitamins. What are the water soluble vitamins? Already discussed that B complex and vitamin C. Now we'll discuss about vitamin C. So vitamin C is water soluble. Okay. And other name of vitamin C is ascorbic acid. What we call ascorbic acid. Okay, ascorbic acid, but it is slightly sour. First character is slightly sour in taste and active. Okay, these are the things. What happened? The chemical name for vitamin C is ascorbic acid, and it is also known as anti-scorbutic nutrient. Okay, in 1747, it is discovered by British physician Lind that oranges and lemons could cure scurvy. Scurvy is a disease, okay, which happened to the sailors mostly who went traveling in seas. So they advised to drink lemon water at that time because in olden days they travel to sea routes, okay, seaways, okay. So the least chance of getting vitamin C. So they're having scurvy diseases, scurvy disease. Okay, we'll discuss that. So basically, in the 1747, he discovered that with lemon and the oranges having vitamin C. So why we need vitamin C? First is for functions of vitamin C. What is the functions of vitamin C? Functions of vitamin C is for collagen formation. First is for collagen formation. Collagen is a major structural protein of connective tissue. So whatever connective tissue are there, collagen is very important for bones, teeth, cartilage, skin, everything. So what it will do, it will made collagen very strong. We have collagen without vitamin C. We have collagen with vitamin C. With vitamin C, collagen is very strong. Okay. It is estimated that collagen constitutes that about one quarter of all the protein in the body. Collagen is formed from a precursor protein known as tropocollagen. Okay, these are the details we doesn't need. So basically, for collagen formation, we need vitamin C. Okay, it is very very important. So if the vitamin C deficiency occurs, so what will happen? Tooth are very loose, bones are very having a very loose affection, cartilage, skin, everything will be very loose and very not that much strong. And second function of vitamin C is creatinine, carnitin synthesis. Carnitin synthesis. What is carnitine synthesis? Vitamin C is required for synthesis of carnitine. Carnitine is a small nitrogen containing organic compound involved in the transport of fatty acids into mitochondria to utilize to release the energy by the use of cells. So carnitine, what will do? It will take the fatty acids into the mitochondria. Mitochondria is present in the cell, energy house, powerhouse. So it required to produce generate energy always because mitochondria having nucleus, that's the reason it have nucleus, okay, to release the energy. So who will help? Carnitine synthesis will help. Next is so will help vitamin C. Next, neurotransmitter synthesis. Neurotransmitter synthesis very important. Vitamin C, there's a vitamin C is required to sustain the activity of the copper containing enzyme dopamine, which catalyze the oxidation of dopamine to form the neurotransmitter neuroepinephrine. So for dopamine, neuroepinephrine, vitamin C also appears to be involved for the hydrolyzation. So the involvement of vitamin C is in the synthesis of neurotransmitters explains the presence of high concentration of vitamin C in brain and adrenal tissues. So very, very important. So for our brain neurotransmitters, we need vitamin C, mainly dopamine and epinephrine, norepinephrine. Okay, next, activation of hormones. Very, very important functions of vitamin C. So hormones releasing factors are synthesized as precursor molecules. Okay, so for that, vitamin C is essential. Vitamin C is necessary for the synthesis of corticosteroid hormones. So to synthesis of vitamin C, we need synthesis of hormones. We need vitamin C. Next, cellular respiration. Other functions are also very, very important functions. Tryptophan metabolism, okay, and immunological functions for immunity, prevention of cataract in the eyes. Nowadays, cataract is also common. So you can, if you utilize vitamin C, it will prevent the formation of cataract. Cholesterol metabolism, maturation of erythrocytes. So for RBC also you need vitamin C. Okay. Drug detoxification. Vitamin C is required for the optimal activation of various drug detoxification. So if you take uh, different types of drugs, any medicines, so for their side effects, you have to take vitamin C and work as antioxidant also. It will remove all harmful substance from the body. And and second important part function is last important function is iron metabolism. So iron metabolism, we need vitamin C. Okay, so it is very, very important, and it shows that we will discuss. Okay, but in iron metabolism, we need vitamin C. So now deficiency. What will happen? Deficiency. Vitamin C deficiency is will leads to different diseases like skin will lose, bones, deformities, tooth deformities, everything will occurs, neurotransmitter problem, hormonal issues, okay, skin problem, tendon problems, delay wound healing because of immunity, okay, bone growth decrease, gingivitis, mostly bleeding from the gun. All this will happen if you stop eating vitamin C, stop taking vitamin C. Now, the source, very, very important, where you will get. So basically, we need 80 to 110 milligrams per day because it's micronutrient. How much amount? 80 to 110 milligrams per day. For man, 80 grams, woman 65 micrograms, pregnant 80 micrograms, lactating 115 micrograms, infant 0 to 6 months 20, 6 to 12 months 30, children 1 to 9 years 30 to 45 micrograms. Okay, so this is very important. Boys 10 to 12 years 55 grams, 13 to 15 years 70 grams, 16 to 18 years 85 grams. Girls 10 to 12 years 50 grams, 13 to 15 years 65 grams, 16 to 18 years 70 grams. So if you take more than recommended days like 3 grams, means it will mostly having osmotic diarrhea, means loose stools. Sources. Sources are very, very, like we have number one. In number one, we will give for amla. Amla having rich amount of top three. I will tell here. 252 milligram microgram per 100 grams. If you take 100 grams of amla, you will get 250 micrograms of vitamin C. Other than other nutrition also. Next is gawa. Gawa jam fruit. It having 22 to 22 microgram per 100 grams milligrams. Other than that, we have gooseberry, guava, already lemon juice. Third one is lemon orange juice, sweet lime, lychee, mango, green leafy vegetables, pineapple, papaya, drumstick, capsicum green. So these are having uh, more amount. Next, custard apple, figs, grapes, mangosteen, muskmelon, pomegranate, sapato or sapota, tomato. This is having second stage of second category. Third, apples, banana, apricots, avocado, plums, cherries, watermelon, jack. Okay, so these are the sources of vitamin C, and you will get one a leafy vegetable that is amaranth leaf. What we call amaranth leaf. Third number is lemon and orange, mousambi, etc. having large amount of vitamin C. And amarnath leaves, it having 60 to 250 milligram of vitamin C in 100 gram. Okay, so this is very important thing. Vitamin C supplements significantly decrease the duration of an episode of cold. This is the now latest uh, evidence that it will reduce the episodes of cold. If you're having patient having cold, it will decrease, reduce severity of the symptoms. During an infection, what will happen? Phagocytes activated to fight the infection, produce free radicals, which are released from the cells. By combining with these free radicals, vitamin C may decrease their inflammatory effects. The effect is due to the antioxidant property. Large doses of vitamin C are prescribed during infection to increase the capacity of healing and immunosuppressants. So, uh, we have to take vitamin C. What will happen? Our immunity develop. So there are low risk of high infections in the body. Okay, so it will protect, and it will also protect de-aging. Okay, anti-aging also it is. Okay, so this is all about vitamin C. So we completed vitamin C and vitamin K. So we left bit complex. So we'll discuss in coming classes vitamin B, complete B1, B2, B3, whatever different types of vitamins available in B complex. Okay, I hope understand the class. Any doubts, kindly ask.